Hello, I'm Francesca Sims. I founded Care Africa Network, CAN, because the erosion of the African extended family community care systems has recently escalated to crisis proportions with the impact of AIDS. There are now millions of bereaved children in Africa. Nothing can adequately convey the tragedy of children traumatized by the deaths of both parents, struggling alone to take on adult responsibilities whilst flung into sudden poverty and food insecurity. To support younger siblings, they may have to leave home and live by prostitution or crime. The magnitude of the AIDS orphan crisis is causing the cost-effective extended family systems to break down altogether, with long-term disastrous consequences and all development aims reversed. CAN aims to tackle this destruction by acting as a catalyst, enabling the regeneration of essential care systems, promoting development and self-sufficiency in meeting the needs of all children and adults now and for future generations. CAN has researched innovative methods enabling communities to provide good care for vulnerable children in Lesotho, Swaziland, Kenya and Uganda. In response to specific requests, it provides training courses, workshops, consultations and publications, and has funded small income generation projects. It also provides training in a very effective method of post-traumatic stress disorder in children. The two-day courses include comprehensive training manuals, and training is free in Africa to CAN extension workers who are committed to disseminating the ideas further and developing projects. Everyone in CAN donates their time and expertise and pays for some of their own expenses as well. So the funds FMNS donates really do go where they're needed to enable local people to have the skills to help children cost effectively. The £900 kindly donated by Festival Medical Services for 2015 and nearly £2,000 for 2016 were used for printing training manuals and purchasing course materials and equipment. This enabled us to run 4 courses in 2015 and 7 in 2016. In 2016, some of the funds paid for participant and venue costs for 2 courses where these funds could not be found locally. In 2015, we trained 55 CAN extension workers and 125 in 2016, nearly all of whom took both courses. These numbers included 26 government social workers in 2015 and 18 in 2016, drawn from each district of Lesotho. In Swaziland, there were 29 participants from NGOs in 2015. In 2016, these 22 trainees also included teachers and nurses. A refresher course was provided for 10 youth mentors from one of our partnership NGOs, who is now developing a project to treat children with post-traumatic stress disorder across Swaziland. In 2016, the National University of Lesotho incorporated the course in the curriculum for their final year social work and social care students. 58 were trained in the treatment of post-traumatic stress disorder and 75 in CAN methods of empowering community-supported family care. Their enthusiasm for the ideas learnt and for developing projects was astonishing. Feedback from all the courses was favourable and enthusiastic. In 2015, the content, presentation, exercises and handouts were all score rated good and between good and excellent in both countries. In 2016, the ratings had improved to between very good and excellent, with averages nearer to excellent. 2016 participants also felt that the courses would help them a great deal to improve the lives of children. Favourable feedback has included that the methods course has the potential to free Africa from the bondage of poverty, and that the courses had transformed participants' lives, inspiring them and empowering them to develop their own projects to change the futures for children in their countries. For example, in Lesotho, government district social workers are now introducing savings and loans groups and training in income generating projects to counter the inadequate welfare benefits to poorest families. This can help move the country forward from poverty and dependence to empowerment and economic development. By developing a wide variety of projects they've planned, the 180 CANWS extension workers trained can have a huge impact on 2 of the poorest countries in the world. More training courses have been requested, for which Foster Medical Services has generously provided £4,000. We would very much appreciate your continued support to meet the demands there and elsewhere. Thank you so much for your support with our work.